In this podcast, I will discuss the condition Osteochondritis Dissecans, which is a pathology of the elbow joint. This condition develops gradually over time through repetitive valgus force that compresses the head of the radius and the capitellum, which, as you can see in the picture, is located at the distal and lateral end of the humeral shaft. Due to this compression, there is disrupted blood flow to the area, and this causes an osteochondral effect to develop over time. Along with this condition, it is quite possible that a fragment of the bone will come loose or even come off and float around in the joint capsule, which can cause problems with the articulation of the joint. Young athletes who participate in overhead throwing and serving sports, such as baseball and tennis, are the most common to suffer this condition. Other athletes that may experience this condition are gymnasts, due to the fact that some of their positions require them to bear their body weight on their hands and their arms. The compressive and tensile forces during the throwing motion or other repetitive motions cause the compression between the radial head and the capitellum, creating the conditions necessary to develop this pathology over time. As you can see in this picture, which is a posterior view of the elbow, the compressive forces are on the lateral side. An athlete who has this condition may come in and complain about lateral elbow pain, locking of the elbow, the inability to extend the elbow all the way to 180 degrees, and maybe even only extend it as little as 90 degrees. And also, they may notice that dislodged piece of bone within the joint space. The diagnosis for this, the only true way to diagnose this, would be through an MRI or an ultrasound image that would show the deformity in the capitellum. While trying to determine whether you will send an athlete in to determine one of these diagnoses, you can rule out other pathologies of the elbow, such as radial nerve entrapment, epiphyseal fractures, and posterior lateral rotary instability. Again, some of these are similar, so the MRI and ultrasound will be the best way to find the osteochondritis dissecans pathology. Different special tests that can be used to lead you down the path to decide to send an athlete in for an MRI or an ultrasound are the valgus stress test. A positive sign would be pain with lateral compression during the test. Also, the use of the chair test, which is conducted by having the athlete trying to lift himself out of a chair using just his arms, with a positive sign being reproduction of symptoms. A third test would be the push-up sign, where the athlete would be unable to perform this test, or perhaps not even be able to get into position because she wouldn't be able to extend the elbow. Again, these tests are similar to some tests for lateral instabilities or other pathologies of the elbow. To treat this condition or injury, there are a couple different protocols depending on whether the fragment has separated or not. If a fragment has not separated, you can have the athlete rest and then start on some progressive range of motion and strengthening exercises to help reduce that compression from the valgus forces in the area. However, if there is a loose fragment in the joint, surgical intervention is needed to remove the fragment and also to clean up the cartilage and other tissue damage in the joint area. To return to play, in either case, and especially in throwing athletes, the return to play would be guarded, which means you would watch the athletes to ensure that they are not creating that stress on their elbow again.